G'day everyone, my name's Beck. I'm the CEO at Timboon and District Healthcare Service. We're bringing you this video today from my home farm in Timboon. Welcome. You might see some of my friendly alpacas there behind me. So really this video is about celebrating the end of the year and bringing you some news about the health service and just touching base again with the community. So it's been a really tough 2 years and lots of people have been working from home and schooling your kids at home, and we recognise that this has been a really challenging time for everyone. So firstly, just good job on getting through it and having the resilience that you need, and the health service is here for you if you need it. I know that it's been challenging for some people because the health service has had to do a lot of different things. We've made attestations and shut our doors at certain times and cancelled different kinds of visits. So I think that's been really challenging for the community. I think today I'm going to talk about what do we think is going to happen going forward, like what is the picture that we're looking towards in the next couple of months and what that might mean for you. So firstly, I just want to say that the health service is here for the community and we have every intent to maintain that. We really believe in the health service, we believe in what it's doing, and we appreciate people's concern about that. I want to alleviate any concerns. The changes have been made because of a period of time, because of COVID, but moving forward we're going to go back where we can to the best service that we can and hopefully grow and get better as well. So I just want to alleviate people's concerns that we all have the same intent here. We're all here to get great patient outcomes for our community and make sure everyone has healthy, happy lives. I think then the second thing is, assume best intent about us. So sometimes we make calls and they don't always turn out perfectly. I'll put my hand up and apologise if that happens, but ultimately we have the best intent. We're here to make sure people get good outcomes and are happy and healthy. So sometimes we don't get it right, but that's why your feedback is so important. Letting us know what hits the mark and what doesn't. Any feedback, I put my mobile phone number out there anytime, so if you've got any questions or you're not sure, just give us a call or call the health service and we'll channel you to the right person. Because we want the same thing that you want, and sometimes we have a different perspective and it looks different to yours, and sometimes we make mistakes and sometimes we totally nail it. So I think what the next couple of months looks like is, in some ways uncertainty, but we're certainly building towards opening up and changing. So I think it's still uncertain, but the future is looking bright. We've got really great vaccination rates in our community, so above 95% for 2 doses. So you should be really proud of yourselves for that. It makes life so much easier. It makes it easier for people to get out and about. It makes it a bit easier for the health service to operate. So the health service will be under different restrictions from the community because we're directed by the Department of Health, and health services, we've got some more restrictions because they're worried about beds and availability and if there's going to be lots of people who are a bit sick from COVID. So that does impact what we're going to be doing. But our full intent next year is to open back up our groups and our exercise groups. So anyone who's double vaccinated, and once the department says we can open those doors again, we want to bring all those groups back, get you back into your routine and your exercise. We're hoping we might be able to increase some of those exercise groups and classes for people over the next year or two, so that you get more access to the health service. So communication is really important to us here at TDHS, and making sure we understand your viewpoint and what's important to you and what's working well for you. So there's multiple ways that you can communicate with the health service and have your voice heard. If it's about a patient care activity, so you've come for a visit or your loved one has come for a visit, you can tell the clinician at the time if you have any concerns or you want something different or you're not sure. If you have concerns about that clinician or that care that you were given or something happened on the day, you can ask to speak to their manager or escalate it to their manager. We also have the executive team who can take complaints and feedback at any time. We kind of categorise feedback in 3 different ways. So we have a complaint. If you have a legitimate complaint, please make it. Complaints are really valuable because they help us learn from our mistakes and learn from your perspective and help us to do things better next time. They're really valuable because they help us learn from our mistakes and make sure that we don't do the same thing again. So we have complaints, we have compliments. So if you have had a great experience or you had a good staff member who did something that you loved, we love good feedback as much as we love a complaint, so you're welcome to put that in. And then we have suggestions. So it's not that something went bad or that something went good, but maybe we could do something differently to support the service and the community to be better. So complaints, compliments and suggestions are one way that you can, or they're 3 forms of feedback that we readily accept. And you can give them either to the clinician or a manager. You can call the executive. We have a feedback button on our website. You can call reception and leave feedback. We have feedback boxes in the health service. So we're pretty keen to get your feedback in kind of whatever form it comes. We have a feedback committee that reviews all of the feedback. So it's different people from within the health service in different areas. So some are managers, some are not managers, some people from the GP clinic, some people from clinical services, some people from admin, so that everyone's different perspective is viewing the complaint. And so someone could be like, wow, why did we do that? And like, okay, whoops. And so it's a team approach to having lots of minds to solve problems. So so you can do it directly with clinicians, you can put in a feedback form, you can call reception, you can call one of the executive team. Like I said before, my mobile number's available, you can call me. We also have a board of directors, and so they oversee the governance of the health service and the overarching direction. And they're really keen and interested in making sure the health service work. That's what they're here for. And so our board chair, Frank, is also available. I believe he put his email out in the newsletter every quarter. Frank will happily take your feedback and suggestions and compliments as well. So we're really trying to make as many avenues as possible for you to give us feedback, good, positive and neutral. Some feedback we take and it's just feedback and we might not change too much. Some feedback we get and we think, oh, we really need to fix that problem. So a good example of that is we have a person who attends our health service and they have a deficit on one side. So this side works really well and this side doesn't work very well. And they can go up the stairs with the handrail, but they can't come down because the handrail was only on one side. I mean, pretty simple, right? You would have thought we'd thought of that, but clearly we hadn't. And so, he gave me feedback one day when I was walking down the stairs and I was like, that is excellent feedback. Let's put it in the feedback committee. And sure enough, we got it fixed and we got another handrail down the other side so people can go up and down the stairs. I think the most important thing to know about me is that I really care about patient outcomes. I think sometimes I can be seen as a bit of a bureaucrat. I'm the CEO. Sometimes I speak, in CEO speak. But I was a registered nurse first. I came into nursing because I care about people. Before I was a registered nurse, I was a primary care assistant. I really became a nurse because I care about people. And the reason I'm a CEO is because I care about people. And I really think that at this level, we can kind of make strategic change to help our clinicians and our staff get better community outcomes. So I guess if there's one thing I'd like you to know about me is that I'm in this job because I think we can get really great outcomes for our community with the service that we've got. And as an individual, I'm really invested in this community. Clearly, I live here. It's such a beautiful place to live. It's such a nice town to be part of. It's a lovely community. I think, the good news is we can now have visitors again for our residents in aged care. They've done a very good job of patiently waiting for that. So it's still limited to 5 a day, but residents can have visitors again, and we're going to have volunteers back in the health service. So I think there's a bright future coming forward. So thank you for your patience. We'll continue to communicate with you about what that looks like and exactly when that's going to happen. But I think the new year is going to be a bit more positive for us all.